I'm Bob DiTullio, born and raised in Connecticut, and I moved to San Francisco in 1979, so I've been here for about 30 years. What I had done, if I could explain that first, was there was this growth in my neck that started to grow and grow and grow. And I had seen a couple of physicians, and they said, it's just a fatty tissue. It's not, it's not anything in particular. Don't be concerned about it. But one day I was at the gym, maybe about 6 months ago, and I was looking in the mirror doing my weights, and I looked at myself and I said, who is that guy in the mirror? And I put the weights down, I went into the locker room, got my stuff, and left.
When I first met Bob, I was thinking, this is my perfect patient. In my business, I'm trying to make people happy, and that depends on, number one, if I think I can do a good job with their problem, and number two, if they're a reasonable person. Bob came to me with this massive excess of skin and fat under his neck, these big bags under his eyes, and he just wanted some help. In a lot of ways, he wasn't my typical patient. He was a sort of neighborhood guy, someone you might not think would be the typical plastic surgery patient, and he just said to me, Doc, it's time. I need something done. When I talked to him, it was very clear that he had very reasonable expectations. He was a good guy, and most importantly, he had something that really bothered him that I knew I could treat.
My mother's side of the family always had deep, dark, pocketed eyes, and I always said that I always wanted to do it when I turned 50. And 50 came and went, and I was like, it's okay, I could just get by. And again, I was at the gym that day, and I was like looking at myself going, who is this person? And it was really funny, because then I started noticing people going, wow, Bob, you really look tired. Are you getting enough sleep and whatnot? And I get 8 hours sleep a day, and I feel like I'm a pretty young kind of 53-year-old. And I said, talked to Dr. Kim again about, well, I'm going to have this while I'm under. How about doing my lower eyelids? And he said, you were a perfect candidate. Again, articulate, considerate, walked me through the whole process.
I make no assumptions about what people know or don't know, and I try to have a conversation with them. The bulk of my consultation is really establishing a relationship, and then from that, everything else follows.
I had a lot of anxiety about doing it, and that night I was like, I kind of stayed up till 11 o'clock, thinking, oh my God, what's going to happen? It's going to be okay. It's not going to be okay. What happens, what not happen? But, I really felt confident in Dr. Kim.
I felt like it was really important to establish trust. He was clearly not a guy who'd had a bunch of cosmetic surgery in the past, and this was a completely new ground for him. I felt like we had to go slowly. We had to go through a very educational process, and I tried to go step by step on every detail of what we would need to do, and let him express his concerns. That's the way I like to approach every patient.
He saw the pain in my eyes or something that was hit it off with him, and he said, I want to take care of this for you. And Sarah Ann was just incredible as well. From her leading me into the room, talking to me, and I'm kind of nervous about this. I was like, do I do this? Do I not do this? And they reassured me that this was going to work out just perfectly.
Surgically, we made a little small incision hidden under his chin, and through that incision I was able to remove the fat from the neck, tighten the muscle, and remove a little extra skin. And for the eyelids, a hidden incision just below the lashes allowed me to reposition that bulging fat to cover up those deep circles and shadows.
In the surgery, we had planned on 3 hours, and it ended up being an hour longer because there was so much fat in there. And Dr. Kim thought that he could just close me up and I could go on my way, or he went that extra step in saying, this is not enough. I have to get to a certain point before I close him up. And I'm glad he did, because it shows. I didn't tell a lot of people because I thought it was like kind of a taboo thing to do for a man to go in and get facial structure done, cosmetic surgery. I hate the word plastic surgery because I don't think that's what it was. So cosmetic surgery, and so I was really concerned. I mean, people at work knew because I had to take the time off from work, and they were really curious about what I was going to do. And when I came back, it was such an overwhelming, wow, you look so great. And I wasn't trying to be a beauty king or whatever. I just wanted to look like the old Bob.
A lot of folks are really scared that if they have surgery, they're going to look terrible. They're going to look overdone or unnatural. And this is just completely against my practice philosophy. Bob is a great example of a guy who we tried to make look younger. We didn't try to change the overall appearance of his look, but just to make him look a little more refreshed. I'd say he looks about 10 years younger, but still looks like Bob. And I think because of that, he's very happy.
People that I didn't tell about this procedure that I hadn't seen in a while, and I'm walking down the street doing shopping or whatever, and I run into people and like, hey, Bobby, how you doing? And it's like, whoa, did you lose weight? Now, for me, like, to lose weight, it's like, did you lose weight? And they were like, did you lose weight? And I'm like, wow, that is so interesting that they're going like this, knowing that there was some kind of change there. And it was so amazing. And then once I told them, they were like, oh my God, you look so great. Because at work, everybody knew I was doing it. My cousin here knew that I was doing it. So of course, I felt like everybody was going to say, wow, you look great. But people that hadn't seen me for a while, they were like, whoa, what's going on with you? You know, what's happening? And so I think my shine is back.